Hi everyone, my name is Mia Harris. I did my flashcard presentation on psoriasis. Psoriasis is a chronic inflammatory skin disease that is caused by autoimmune activity, and it is believed to have a genetic predisposition. But recently it has been discovered that some people who have psoriasis do not have the gene that predisposes them to getting the disease. Psoriasis affects about 1 to 3% of the population. The onset usually begins in the teen years, and it is marked by remission and exacerbation that varies according to location and severity. So these are just different types of psoriasis that I have here. I'm not going to go through the whole list because they pretty much all have the same pathophysiology or etiology. So I'm just going to go right down to the pathophysiology. Okay, so pathophysiology. So psoriasis developed due to abnormal activation of the T cells and an increase in the cytokinase that causes inflammation in the targeted tissue. So basically the T cells attacks the body's own skin cells, which causes the body to rapidly and excessively produce new skin cells, the keratinocytes. So the excessive cellular proliferation leads to thickening of the dermis and the epidermis. So normally the epidermis sheds every 2 weeks when new skin cells develop, but with psoriasis, the epidermal shedding and proliferation occur in 1 day, which is the exacerbation. So the estrous cells will pile up on the skin and form lesions. The lesions will begin as a small red papule in the acute inflammation stage, and then they get enlarged afterward. So the lesions progress into silvery plaque, but they will have a red base due to inflammation and vasodilation. Risk factors for psoriasis include stress. Stress can trigger autoimmune response, which can also trigger psoriasis. Skin injury, example sunburns or any type of cuts, or any type of tissue injury can trigger the inflammatory response, which can lead to exacerbation of psoriasis. Infection such as strep throat can lead to the immune response and may trigger psoriasis to flare up. Weather, the extreme cold or heat, smoking tobacco, heavy alcohol use, and also the genetic predisposition as well. And some medications such as lithium and prednisone and hydrochloroquine has been known to cause to be a risk factor for psoriasis. Major signs and symptoms include the redness, the red patches on the skin, which are covered with like silvery scale. With so the base, like I said, will remain red due to the inflammation and vasodilation. There'll also be small scaled spots on the skin, and this one is common in children. Dry, cracked skin that may bleed, itching, burning, or soreness on the skin. Thickening, padded, ridged nails. These are all symptoms of psoriasis. Also swollen, painful joints, swollen, painful and stiff joints. This is particularly for arthritis, psoriasis. Diagnosis testing. So physical exam will be done first to kind of determine the characteristics of the lesion to see if they are consistent with psoriasis. This can be done with the naked eye just by looking at the lesions or using a magnifying glass. And then a skin biopsy will be done to determine if this is a psoriasis or not. So the skin biopsy, where a piece of the skin will be taken and examined under a microscope to determine the cause, to determine if psoriasis was the cause of the lesions. So that's that, and these are my references over here, and that's it. Thank you. Have a nice day.